Hello, everybody. This is Dr. Magarelli from CNY Fertility, Colorado. How you all doing today? Welcome. Welcome to our Facebook Live. All of you folks on Instagram, please jump over to Facebook and YouTube. We're doing a lecture today. Welcome. All folks who are on Instagram, jump over to YouTube and Facebook Live, because we're going to be doing a lecture today on progesterone. Progesterone is something that a lot of people have lots of questions about. And so what I'd like to do today is kind of go over the history. So all you folks, all you 41 lovely people on Instagram, jump over to Facebook Live. Hello, Mercy. We are good. All right. Nice to see you. Anybody who's on like Kayla or A-Hope, the Journey Through IVF, hello, all of you guys, jump over to Facebook Live or YouTube. We're doing our lecture today on progesterone. Hello, Ronald, Travel in Harmony. All you folks who are on Facebook on Instagram, jump over to Facebook Live and YouTube. I'm going to be doing a talk on progesterone. Hello, Trish, Trina, Kylie. So nervous, Kylie, about doing progesterone. Amanda, looking forward to another great lecture. Thank you, my dear. Progesterone levels for a fresh transfer. You bet. I'm going to be talking about that. Majana, Tanjika, Catherine, Kara, 603, all you folks who are on Facebook Live, who are on Instagram, jump over to Facebook Live, because I'm going to be doing a lecture on progesterone. We are doing good. Good to hear it. Jump over to Facebook Live. Miracle Baby 36. FYI, babies Elliot or Nophelia. As everybody knows, I love to name every single embryo. Probably have named 300,000 embryos. Don't know. But I love to name every embryo we transfer. Anybody who's on Instagram, jump over to Facebook Live. We're going to be talking about the lovely topic of progesterone and IVF outcomes. Very challenging. Ashley, thank you for taking wonderful care of me last Tuesday. You got a great crew in Colorado Springs. Thank you so much. We try. We're not perfect, but we do the best we can. Hello, Trish O'Hare, Kylie, Amanda, Devin, everybody who's on Instagram, please jump over to Facebook Live. I'm doing a lecture today on progesterone. Chloe's baby journey, 2 successful betas since we transferred. 2, you did too. Okay. Well, I'm so glad you're pregnant. Good for you. In Colorado from Minnesota, doing my monitoring. We'll be seeing you soon, Alicia. Good to see you. So everybody who's on Instagram, please jump over to Facebook Live or YouTube Live. Progesterone is a really important topic. Is there such a thing as too high? Is there such a thing as too low? Is there such a thing as you don't need it? So we're going to explore all of that today. So all you wonderful folks who are on Instagram, jump over to Facebook Live and tell your friends, because they can, by the way, these are all recorded. So if you want to review them, it's going to be a fun lecture. Cairo 1257, jump over to Facebook Live. Barbie 72525, jump over to Facebook Live or YouTube Live, and you'll see me there. And the reason you're going there is you can see the actual slideshow. That's the most important thing. Is I like to teach, of course, people who know that about me, and I like to give you some factual information. And my purpose is we're all in this together. Okay, so I'm going to jump into the talk. Everybody who's on Instagram, please tell, I don't have Facebook. Can I watch it here? Well, yes, anyone, by the way, on Instagram who doesn't have Facebook can go to YouTube Live. I think everybody can go to YouTube Live without CNY Fertility YouTube. I don't think you have to be on Facebook. So it's CNY Fertility. That's the Facebook. CNY Fertility. That's the YouTube. CNY Fertility. And all of you can help each other, but everybody who's on Instagram, jump over to Facebook Live or YouTube. Hello, Amber. Good to see you. Okay, so I'm going to jump into the lecture. So, progesterone and IVF outcomes. Everybody wants to know about that. So we're going to sort of jump right in. If it'll let me jump. I'm ready to jump. I'm ready to jump. So what is progesterone? Now, progesterone is oh, there you go. They're, I guess, helping each other on people who are on Instagram. Follow that, ladies, to YouTube to find out how to get to watch us on YouTube over here. Okay. So progesterone is a steroid hormone. Some of you know there's all different types. A steroid hormone is used, this little ball and stick form. It's produced by the ovary in an ovulated follicle. And an ovulated follicle is called the corpus luteum. So in a natural cycle, the body first starts, the first 14 days of a cycle is called the proliferative or growing phase. The second part of the cycle is called the secretory phase. And during the first part of the cycle, the ovary and the follicle act as engines or factories to make estrogen. With ovulation, there's an abrupt stop, and then it changes to a progestation factory. So if you look at the menstrual cycle, this is a cross cut of the uterine lining here. You see you had your period during the first, second, or third day of the menstrual cycle, and then you see the proliferative phase, in other words, the growing phase of the lining of the uterus. Now, this is driven by estrogen, and it's driven by the growth of the follicles, and the follicles are the stuff that we measure. Now, with ovulation, and in our case with trigger shot, this estrogen factory converts, because of LH, to a progesterone factory. So now you still have some growth, but now you have stabilization of the uterine lining in preparation for the embryo to implant. So the ovulatory follicle now converts from an estrogen factory to a progesterone factory. Here's a nice blow up. And you can see during menstruation, your follicles are small. They grow, 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 grow. This is what we measure. You ovulate in a regular cycle. In an IVF cycle, you don't ovulate. And then you start producing progesterone, which holds the pregnancy ready. So it's functionally able to accept the embryo. So in a natural successful ovulatory cycle that results in pregnancy, you need approximately 40 nanomoles per liter of progesterone, or in the American system, 16 nanograms per milliliter. So if you have a progesterone level that's above 16, you are fine for a natural pregnancy. So people wonder what's too low. Well, if you had lower than a 16, of course, then you would have a problem, and so we could supplement. So, very simple. Progesterone is required for implantation to occur. So, if we're going to, in an IVF cycle, if we're going to give progesterone, when does it start? Well, in a fresh cycle, on the day of trigger, the actual trigger mechanism, the either lupron causing LH secretion or HCG causing doing the same function as LH, it begins to change the follicle from an estrogen factory to a progesterone factory. So it's the moment you guys get your trigger, you're already preparing the uterine lining. Now, in a frozen cycle, it's very different, because in a frozen cycle, there's no follicle to ovulate. So what happens there is we back calculate the day of transfer so that we have at least 6 days, or precisely 6 days of progesterone therapy before we put the embryo in. Now, that's if it's of course, if it's a blastocyst that we transfer. If it's a day 3 embryo, of course, you need 3 days of progesterone. There's a logic to it. And what's the logic? Well, it turns out that in a natural cycle, fertilization occurs in the fallopian tube. We consider that day 0. And it takes 6 to 8 days for the embryo to divide, become a day 3 embryo, then become a blastocyst. And a blastocyst, a day 5, 6, 7, or 8 day embryo, is the only thing that can attach to the uterine lining and implant. So that's where the magic 6 days came from. It's not magic at all. it's duplicating what our natural cycle does. So the more we replicate nature, the higher the pregnancy rates. I mean, that's our philosophy about the management of IVF. So for fresh, you start the progesterone the day after retrieval. For frozen, you start the progesterone 6 days before transfer. Now, again, I'm saying on average because there's a lot of other mitigating questions as to what you do and how you do it. So that's sort of the basic physiology. I wanted us to all kind of be on the same page with the basic physiology. So then we, in the clinic, hear lots of questions like, well, how much is progesterone do I need? Is it too much, too little, etc.? So I decided to review the current literature, starting probably 2018 to now. But you got to remember, there's other literature out there that goes back 20, 30, 40 years, and Google doesn't know the difference. See, Google doesn't know the difference between 2022 data and 1980 data. It just doesn't. So I tend to look at the most current to get a summary of all the brilliant minds that have been in this field now for almost 40 years. So let's talk about this first study. This was done in 2005. And what they did was they looked at progesterone levels from as early as 4 weeks gestation, which is 2 weeks after the egg has been retrieved. In other words, that's the time when you get your pregnancy test. And what they found was that progesterone levels were significantly elevated, and they predicted the women destined to have an intrauterine pregnancy. So in this study, they basically said the higher the levels of progesterone, the better. They didn't set a level that was too high or too low. They basically said the higher the better. So good baseline, 2005. And this is the data. And what they found is if you looked at the levels of progesterone as they go up, this is nanograms per deciliter, as you increase the amount of serum progesterone, the chance or the predicted possibility of a pregnancy, 100% being 100%, you can see that it went up as you increase the levels of progesterone. So pretty darn cool. We know. So now we know that we have to give progesterone, and the more we gave, the better it was. Then another study came out, this is 2018, which says that if you have a low level of progesterone, it's bad, meaning you won't get pregnant. But if you have a high level of progesterone, then it's good. And they use 14 nanograms as the split. So if you were below 14, yeah, the idea that the chance of having an ongoing pregnancy was low. If it was greater than 14, then lo and behold, you had a very good chance, a statistically significant chance of improving your pregnancy chances. Now, it's not 0 before 14. This is what's important. If you're doing, let's say, a fresh transfer, your body is always producing progesterone from the corpus luteum as well as the supplementation. But here's a number. Greater than 14 seems to be a good number. That seems to be the same for many studies. So this study, and this was in 2020, said, well, wait a second, maybe there's no difference in the amount of progesterone that matters. So what they found was, and again, they used 10 nanograms as the breakpoint, and now we know that that's probably not good because they should have used 14. But they used 10, well, not should have, but we found that 14 is the number. They found that there was no benefit to having progesterone above 10. So no benefit. So this was in a frozen embryo transfer where you're getting no endogenous progesterone from the ovaries. So all you guys are on Instagram. I'm doing a lecture, and if you go to Facebook Live or YouTube Live, you can see the lecture, and then I'll come back to answer questions here. So in this study, which was based on 2,000 frozen embryo transfers, they said, okay, for this group of patients, we could not see any benefit. Another study, and this is the one that I think a lot of people are referring to, and I'm going to show you this, and that was in this study, Thompson did a prospective cohort, observational, non-selected population, just anybody who wanted to come in, etc. study, and what they looked at is maybe there is an optimal range for progesterone, not too low, not too high, something in the middle. And what they found was that they took the progesterone levels at 2 points. One was the first or second day after the retrieval. The other one was approximately 5, 6, or 7 days. So they call that the early luteal phase, and then they did the mid luteal phase. And what they found is that if you had anything in the early luteal phase that was between 25 and 40 nanograms, early meaning the first or second day after retrieval, that portended for the optimal chance of pregnancy. But if you did it at the normal day, which is about 5 days after transfer, when we do it, anything between 60 and 100 seemed to be the level that was optimal in this study. And what they found was there was about a 10% difference in pregnancy rates. If it was greater than 400 nanomoles, per liter, they found that there was a decrease in pregnancy. So this was the first study that really looked at pregnancies as a function of the levels of progesterone at different levels and at different times in the cycle. So if you just want to look at this chart here, these bars in the histogram, the higher the bar, the better the chance for pregnancy. The lower the bar, the less the chance. And this is low levels of progesterone and 60 nanomoles up to 400. And they found this sort of almost a bell-shaped curve, with the optimal being somewhere between 60 and 100 in the which is 24 to 40, when most of you will probably get it. Or a little bit later, it can be from 60 to 100. So in a sense, let's say you're not exactly sure when you got it, anywhere between 24 nanograms to about 100 nanograms would be in the optimal range. So now this has caused very many people to get scared because, oh my God, what if my level is too high? Too low, everybody, it's easy. Just add progesterone. What if it's too high? Well, let's make sure that there's such a thing. So in this, and here's just a way of looking at the how age affects the level. So and in terms of in this one, the progesterone was in that 150 to 250. There's your optimal, and these are suboptimal across all ages, is what they found in this study. So now, well, in a year later, Netter comes out, redoes the study, and he looks at the levels of progesterone. And what he found was that the high, this is the Thompson study that I showed you. In his study, what he found is the more progesterone you gave, the better the outcome or the odds of getting pregnant, keeping the pregnancy, and getting a live birth. So in a sense, he's refuting this idea that you can have too much. The vast majority of all the studies say yes, having enough is good. So Tracy, a 49, perfect, good job. But in his study, he's saying, well, wait a second. In our study, we did not find that same correlation. And this is what you find in research when there's only 1 or 2 studies looking at levels. So there's a lot of folks who are very afraid because of Thompson's study. But now there's another study which refutes Thompson's data, which basically says to me, if your levels are over 14 nanograms per deciliter, you're in good shape. You're in good shape. And this is going back way back to 1990. This was in the beginning. And what they found was that in those, now this is interesting, in those cycles where we didn't provide progesterone, it didn't matter what the progesterone levels were when it came to reproductive outcomes. So this is a historic piece of information, but this is the groundwork that began to get us to question, well, wait a second, 0.9 nanograms per mil versus 14 nanograms per mil. So these folks, this is looking at studies, were nowhere near even the threshold of a natural cycle. So again, watch the studies that you look at. So there's a very recent analysis of all studies looking at when you need to stop the progesterone supplementation. So in this study, what they found was that there was no difference in long-term birth outcomes if you took progesterone all the way through to the heartbeat or if you stopped at the pregnancy test. They found that as long as you maintain the progesterone, right, up until the pregnancy test. Now, it's controversial. You can see there's a trend here that with if you stop progesterone early, this little diamond says you get a better outcome. That was true. Here's another one where it said that that providing a little bit more progesterone, in this case, adding the progesterone, you get a better outcome. Here is just looking at whether or not those HCG boosters. Now, the HCG boosters, you got to remember, were given way back when we didn't have progesterone. Remember, that was, well, you don't remember, but you don't know this, but in the past, we would give the HCG as a way of getting the corpus luteum to live. But now in a frozen cycle, there is no corpus luteum, so an HCG booster kind of doesn't make sense, right? Because it's boosting the corpus luteum. And even in a fresh cycle, I'm not sure the HCG boosters make sense because we're actually providing the progesterone. Now, again, there's controversy and everything, but in my mind, it's like, So here's just comparing HCG boosters with progesterone. You can see that it favors, you can't read this, but the diamond is to the left of the line, which means it favors progesterone. So doing the progesterone is good. So what do you think? Is too little progesterone bad? I would say yes. Is too much bad? I would say the jury is out and probably doesn't matter, because about 7% of couples fell into that, women fell into that too much category, so very few will ever get those levels that high. Should we add progesterone? Although there's a little bit of controversy about adding progesterone, most of us in the field believe that you continue progesterone until you get a heartbeat, which is about 7-8 weeks in the fetus. And by then, you're getting the progesterone from the placenta. I mean, it's a self-fulfilling system. So you don't have to do it after that. Some people keep it to 12 weeks. Should we stop progesterone at the pregnancy test? I would say most of us say no. So my recommendations. If you can tolerate progesterone oil, it has the most information in the literature about efficacy. So that's good. You can combine progesterone and oil with vaginal crinone and endometrium, but please note that vaginal progesterone works at the level of the uterus and the bloodstream will not measure the blood levels. So measuring blood levels, it's just you got to know that by taking it is all that matters. Is it extremely unlikely that less than 7% of cycles that there's such a thing as too much progesterone? And to sort of go back to a study back in 2013, what they found was that when they doubled the amount of progesterone that was normally given, which was 180 milligrams of progesterone a day, milligrams, that's 1,000 more than a nanogram, they found that their outcomes were better in frozen embryo transfer cycles. So I think for most of you, worrying about progesterone is not going to be helpful. It is it's almost impossible for you to have too low a level if you're doing the injectable plus the vaginal. It's like you can get away with just using the vaginal, but then I would double it up. I would do the 2 crinones a day, using that as an example. And so that's it. That's what I thought we would talk about today. If you have any questions, please just let's start with the questions. If Tricia, if progesterone is so important, why won't the OB doctors test it? OB doctors, no. By the time you're pregnant, you don't need to test progesterone levels. This is only to the point of the creation of the placenta. So I just did a transfer a week ago. My progesterone level is that 145? Tell me what that is, Tracy. I'm not sure what that number is. Can I take 200 milligrams of progesterone orally daily until birth if I have an incompetent cervix? Usually that has nothing to do with an incompetent cervix. That's a mechanical problem. And continuous progesterone, like I said, after 8 weeks, the placenta takes care of the pregnancy for you. All righty. Let me take a sip here. Vaginal bothers me. Can I use just progesterone and oil? Absolutely. Most of the studies were done using progesterone and oil only. So believe me, I'm a firm believer in progesterone and oil. Is taking oral progesterone prior to retrieval necessary or helpful? The most efficacious way to do it is injecting it or vaginally. Um, um, Ashley Whitman. Hi, Dr. Mag. See you next month. Okay. Tanarika. So HCG boosters doesn't help if you are doing a frozen transfer. Not that I understand. I don't understand the mechanism by which it could help, because its goal is to support the corpus luteum, and there is no corpus luteum in a frozen embryo transfer cycle unless you're doing a natural cycle. What levels at egg retrieval do you need to do a fresh transfer after retrieval? Great. Progesterone has to be at the time of trigger less than 1.5 to do a fresh transfer. We didn't do that talk today, but anything above 1.5 portends for a much lower pregnancy chance at the time of retrieval, because what happens is it disconnects the lining with implantation. How can I get my progesterone up? Mine was extremely low on my blood level, and I really want to have a baby. So take it vaginally, because again, your blood level won't tell you anything, and take it by muscle, and you will be fine. What about the weekly progesterone given to support the pregnancy after 12 weeks? I think that's just a preference by some doctors. I'm not sure how that works. What if progesterone dropped a little from transfer to midway? I went from 24 to 21. Absolutely no worries at all, because you're doing the suppository. Ashley, you put me on Amitrip a couple of weeks ago. Should I stay on Amitrip through stims? Absolutely. What about taking both HCG booster and progesterone supplements for natural cycle? Good idea. For someone who has been on Clomid for 3 cycles, what doses of progesterone do you recommend for successful implantation? Is 200 vaginally enough? Well, again, just be Kimmy. I would do injectable progesterone and crinone or endometrium. I would not. I don't have enough data on the use of prometrium vaginally. I would either use endometrium or crinone and injectable. I did my frozen transfer a week ago in Colorado. My progesterone level is 14. And that's good. Above 14 is good. How does progesterone predict when your period will come? How does progesterone predict when you? Well, it's because it's the removal of progesterone that causes you to have a bleed. So when you take the injection, about 7 days later, you should have a bleed. What do you think of Lupron flare protocol? It's an old-fashioned protocol. I haven't used it in a while. Not sure what the benefit of it is today, because growth hormone is probably the better help than the Lupron flare, but it's not going to hurt you. I think you can do it. How long do you recommend priming before retrieval? Well, Trina, well, it depends on what the issues are, but they're usually 1 month. What do I need to do before my consultation to have my paperwork ready? Download our family building guide, and it's all there. Do you recommend increasing Omnitrope 6 units during stims if on 3 units for prime? Yes. Tiffany, what is this? Don't know what the question is. I had an FET last Wednesday. My progesterone was 30 and estrogen was 50. Is that good? It was fantastic. Everybody's joining. Hello, everybody on the Instagram side. If you have questions, how many cycles of ovulation induction with a trigger do you recommend before moving on when everything looks good? Usually 3 months, 3 tries, 3 successful tries. What do I mean by priming? Well, priming is just it's just a fancy word for giving estrogen and growth hormone before the retrieval. And when you have low ovarian reserve, then that might help. Will C and Y postpone the retrieval for fresh if progesterone is too low, as you mentioned? No. At the trigger, you want your progesterone to be less than 1.5 for a different reason, and that is getting the uterus ready for implantation. So we're not talking about that. We're talking about progesterone supplementation after you're pregnant, right after the transfer, okay? We're not talking about it before the retrieval. Hello, everybody on Instagram side. I had a transfer last Friday, but was told I don't know what Shelby you said there. You had to spell check something. I've had 4 failed transfers doing an ERA now. One woman's progesterone timing is adjusted according to the ERA. Have you found it? Yes. Well, yes. I didn't want to talk much about the endometrial receptivity assay, but remember I said you needed 6 days of progesterone. With this assay, some women actually need 4 days, some women need 8 days. So with this assay, we're able to find out what exactly the length of time, not the amount, the length of time you need progesterone. I am preparing for an embryo transfer next cycle. I want to go to a laser skin treatment for wrinkles during my ongoing cycle. I would have no idea, Elaine. You might want to talk to them. I can't see how it would hurt, but again, I have no idea. Molly, how do you know if low progesterone is causing recurrent miscarriages and you were on progesterone 200 milligrams? How do you know? Well, you don't know. We don't know what causes recurrent pregnancy loss most times. Any recommendations to help with knots in the muscles from the PIO shots? Okay, all you ladies who've taken progesterone and oil in your butts and in your arms, please give her some suggestions. Shelby, I had a retrieval last Friday. Was told I can't do fresh transfer because I'm having OHSS. How long do I have to wait? You could actually do it the next month. Tiffany, do you recommend priming on Omnitrope before retrieval? My protocol only recommends during stims. I have low ovarian reserve. Yes, if you can do it before, Tiffany, it's always good. I was hyperstimulated at retrieval, got 14 fertilized. Wow, they will be testing them. Do you recommend waiting a cycle before doing it? Oh my God, yes. If you're, did you say you were hyperstimulating? Yeah, just wait a cycle. How soon after ovarian PRP should you start a stim cycle? The next month, Ruth. Devin, after retrieval, if I want a fresh transfer and it was too low, would they put me on progesterone to try to boost it for a fresh, or would they automatically? No, Devin, they are not going to check your progesterone levels they will automatically put you on progesterone when you're doing an IVF cycle, fresh or frozen. The levels I'm talking about are the concern people have, which I've just shown you in this lecture. There isn't a concern. As long as you're getting supplemental progesterone, it is entirely unlikely that that's the cause of you not getting pregnant. I'll say it again. If you're on supplemental progesterone, it is entirely unlikely that that's the cause for you to have a failed retrieval transfer. Why do we do Omnitrope if AMH is perfectly normal? Well, if you have poor ovarian quality, that would be one oocyte quality, that would be why. So if someone is doing an ERA and they find that you need 8 days, is that why you should get a low progesterone level on transfer day? No, that is not the reason. What do you recommend to do? When do you recommend a low dose protocol when there's low ovarian reserve? What do you think about estrogen, aspirin, progesterone protocol for day? Well, absolutely. Estrogen, aspirin, and progesterone are our standards. And there's some hints about the knots. Massage the area. Sometimes a heating pad helps too. What about timing of medications? Do they need to be the same time every day? Within an hour or two of the same time. It's not a religion. Ashley, I told you I watch all your lives. See you in a few weeks. Thanks, Ashley. I haven't done PIO for about 8 weeks after chemical pregnancy. I still have pain about 6 inches below the inception site. Well, Courtney, it may be that you hit a nerve. Sometimes when you do the injections, you can hit a nerve, and that can take a while for it to heal, but make sure the nurse takes a look at it, make sure it's not red and burning, okay? Good. All righty. So we're talking about progesterone. We're talking about that basically there's really too low a progesterone can be problematic. Too high, it's likely to be a problem at all based on the current literature. There is one study that looks at that, but then there's another study that refutes it the very next year. So this idea of, oh my God, I have too much progesterone, please don't worry about it as far as the literature is right now. Okay, Amanda is suggesting to go on YouTube Live for how to give a shot. Hill Scooby, High-Low Scooby. Dr. Kilster started me on an immune protocol. I haven't uploaded my consent. Should I start the immune protocol? Sure. Okay, love the weekly lives. I do too. What do you think about add-on meds like Lovenox and Plaquenil or prednisone? Can you do a cycle without them? Absolutely. You can do a cycle without them. Absolutely. Could we up our injection dose and get rid of the suppositories? Sure. Well, sure, Ashley. But talk to the doctor or the nurse about the amounts you need, okay? You're very much welcome. All righty. Very sore. Okay, I got kisses. Who's sending me kisses? I love kisses on Instagram. Okay, oh, there they come. I love those. All righty. Any other questions? By the way, it doesn't have to only be on progesterone. It could be on anything. I was put on immune protocol 3, but cannot afford the Neupogen. Is that bad? Not at all. Is there any way to keep progesterone low before egg retrieval? No, Sonia. You are my doctor. I know that, but I can't talk about that online, Ashley. Well, as a patient, you need to talk to me, okay? I can't give medical advice on Facebook, or I guess I am. Is there a way to keep progesterone low? Not really. I have one closed tube and dilated tube. Do you have to remove a dilated tube before transfer, Angela? Well, only if there's fluid in it. If there's no fluid in it, hydrosalpinx, you don't need that. I had Facing Destiny. I had my SIS and they found a fibroid. She said I need to have surgery for removal. That is true. If it's inside the uterus where the baby will be. Is it a good idea to check progesterone the day after transfer? Nah, it's too soon. It's too soon. Yeah, it's not going to be. That's that one study, but that's even 2 or 3 days. No, that's too soon. As long as you're taking your progesterone medicine, it is not the progesterone that's going to be the reason you're not pregnant. When should someone order medications for an IVF cycle? That's going to be done by the nurses with you after you've done your financial consult, after you've done all your testing and you've secured the plan. That's probably the time to do it. Amala Unique. I have had 2 consecutive subchorionic hematoma. Could Lovenox be the cause? No, Lovenox is used for subchorionic blood. That's abruptions in the uterine lining. Because the uterus is a very unique place that can actually help. My thyroid level is slightly elevated. Will that affect IVF? Not the retrieval, Michaela, but it will affect the transfer if it depends on what is slight. Make sure that you have the nurses review it. If it's around 2.0, the TSH, you're fine. If it's like 3.0, then you want to lower it. How do I upload my imaging? Chelsea, I would call up the helpline, our 800 number, and they'll help you do that. I don't know exactly how to do that. For a modified natural cycle, what should progesterone be on day of transfer or day before? Well, that's that fantastic, 14 nanograms and above. So, 30 would be great, 20 would be great, 40 would be great. Are there cheaper minimal options to the IVF medication? Yes, Kayla. You could do oral medications, a combination of oral. Hill Scooby, Hilo Scooby. Is Omnitrope necessary? No, it's an add-on. It does help in certain circumstances, but it's an add-on. I had a consult with a doctor at CNY. He recommended I get a DNC for a frozen embryo transfer since I've been struggling with thinning with lining thickness. I've heard you say Lupron shots work. For what do I recommend? Well, Norma Axo, every person is different. So sometimes the DNC, I'm not one for instrumenting the uterus, but sometimes that's all you can do to get it thin enough. And I've had certainly cases like that. Can I have my tubes unblocked? You can try. We do that at CNY. Is it normal to spot for a while as a first cycle after miscarriage? It's been 2 weeks. It could be. You need an ultrasound to see why you're spotting. So I'm on Clomid currently and have a consult on the 3rd. Could they just incorporate trigger or something with that for my IVF? I'm sorry. Kayla, I think you need to understand that the IVF cycle is completely controlled. It's not willy-nilly. After my J&J in August, my cycle became a nightmare. I don't know what a J&J is, sorry. Current day 50, no period. FSH tripled from June to now, putting me in menopause. My FSH is 30. Is there hope for my eggs? Sure. But I would get an AMH, and then I would start getting care as soon as possible. But it's going to be a challenge. Who do I speak to if I started getting meds from the pharmacy but haven't spoken with the financial team? you're either wherever you're going. So if you're going distant, then you need to use the global travel folks. Otherwise, if you're local to Colorado, Syracuse, you call the Syracuse team or the Colorado team. Do you have an opinion about ketamine infusions for mental health? I have not one impression or opinion of that. I do not get my period. If I go in for baselines and my lining is thin enough for FET, are there pros and cons? Oh, yes. You don't have to have a bleed to do a frozen embryo transfer. Not at all. You just have to have a thin lining and no activity in the ovaries. Is it 2.1 TSH high or is it good? It's good. What are your thoughts on day 3 transferring 1 or 2 embryos? It has to do with age, past medical history, risk of twins, etc. Is there anything else we can do to help transfer be successful? Acupuncture, serovital, growth hormone, keto diet. Look up and download our family building guide. Kimberly, I have a consult late February with CNY. Out of curiosity, presuming we have a plan exiting the consult, what does the time frame look like? It's about 2 months. What add-on medications help to grow a thin lining? Well, estrogen, Viagra has been questionable, PRP infusions, Neupogen infusions, HCG infusions in the uterus. Hello, Scooby. I'm in Hilo, Hawaii. Great. We had somebody from Hawaii this last week. What if I don't have facilities to do the testing? That's hard to believe since in Hawaii, IVF is a covered benefit. So take a look because most insurance companies cover IVF in Hawaii. At 44, do I still stand a chance with IVF? Well, it's depending on your eggs and your family history. How long is the process normally from start to finish for IVF? It's 11 days of stimulation. Then about 2 days later, we take the eggs out. And then if you're growing the embryos, we grow them and put them in. So that's another 5 days. So about 17 days if you're doing fresh. What are intralivid infusions used for is to reduce inflammation. Does HCG wash before transfer help with success rates? There are studies that suggest that it does. So I kind of lean towards those. They're not great, but it's not that expensive to do it. When does the Neupogen happen? Is that just an injection into the uterine lining? There's 2 ways to give it. One way is by injection in the uterine lining to prepare the uterus, and there are specific protocols for that. Trinice, I just had a miscarriage a few months ago going in for an IUI. What should I be taking to increase my chances for a successful birth? I'm 41. Well, acupuncture, all the vitamins, download our family building guide, Serovital, which is a vitamin you could pick up at Costco, avoiding alcohol, tobacco, drugs, non-smoking, all that stuff. This okay. Shelly loves acupuncture. So do I. All right. Not for us. No facility here would do my husband's semen analysis, so we flew to Oahu. Oh, okay. I'm worried about getting my labs done. We do not have LabCorp here in Hawaii. So, well, the other option is come to Colorado Springs for 2 weeks or 3 weeks, and we could do the whole process. And I think there are online labs now that you can send stuff to. Anybody who's done it in Hawaii, actually call our global travel nurses. They will absolutely help you. Call our global travel nurses, and they will help you in Hawaii. And Dr. Fratarelli is a friend of mine in Hawaii, and I'd be surprised if he wouldn't help. And yes, I think he's on Oahu. Now, how long after a laparoscopic procedure can someone do an FET? 4 to 6 weeks. Could I take supplements once a day? Yes. That was simple and quiet. Everybody's quiet. Okay, I've had 3 recurrent pregnancy losses, and 2 of them were consecutive losses with subchorionic hematoma. Does that mean I'm always going to have it? No. But you might want to get a workup. You might take aspirin, Lovenox. These have been shown to be helpful. Bed rest. Acupuncture, by the way, has been shown to be very helpful. Is male infertility a large issue for IVF? Not in terms of fertilization. Fertilization with ICSI is very helpful. But if the male has severe male factor, yes, it has a big event. And also, if men smoke, that has a big impact on miscarriage rates in women. What is that used for? I'm new. Felicia is male factor. What is what? Oh, Serovital is a vitamin complex that you can get. Always get the least expensive Serovital. Don't get the more expensive one. Get the original one without the caffeine. It causes your own body to increase 600% the growth hormone secretion, and that's important for oocyte health, for sperm health, for uterine health. It's very inexpensive at Costco. So it's something I take every single day just because I'm an old man. Hearing you answer all these questions so quickly is awesome. Okay. Oh boy. If you double your progesterone pills, you wouldn't have to take the progesterone shot. That's the question. See, I don't think the progesterone pills have a lot of good studies. I would always suggest the shot or endometrium or crenone. They're designed for that. Okay, they're designed for that. Is 3 months of supplements imperative for success with low AMH? No, Heather. It's whatever you can do is imperative. Which one has a higher success rate for IVF, a fresh or frozen transfer? Thelma, that has to do with the person and whether or not they have PCOS, whether or not they have high estrogens. That's what determines whether you use a fresh or a frozen transfer. There's no one that's better when you could do either. That sounds weird. But if you're doing it for convenience, the fresh and everything is fine, it's as good as waiting and doing the frozen. But if you're doing it because you have PCOS or excess estrogen, then absolutely you want to do a frozen. Would you transfer an abnormal embryo, which is a high grade, which is a high level mosaic? Yes. Oh, no, highly graded. No, the grading has nothing to do with the success of that embryo. The chromosomes do. What should estrogen level be at frozen embryo transfer? It should be above 300. For FET, after I stop my cycle, when can I roughly expect my transfer to happen? 17 days. All righty. We're cooking here. Thank you. You're welcome. PGD testing, do you trust it? I'm not in the business of trusting. I'm a scientist, physician. I'm more a scientist than I am a physician, to be honest with you. So there are specific situations where PGT testing makes sense. There are lots of situations where it doesn't make sense. I think the consensus now, if you're less than 35, not as helpful as we thought. If you're 35 to 40, possibly pretty darn helpful. If you're over 40, probably not as helpful as we thought. So it's changing. Right now, that's kind of my break point for saying, hey, you should do it, is if you're between that 35 and 40. If you have a reason, like you have a genetic disease, of course, you have to do it. Missy, I had a successful embryo transfer, but no pregnancy. I'm curious what could be the reason why I didn't get pregnant. Too broad, Mrs. Too broad. My right ovary is always hard to find using vaginal ultrasound. My right tube has been removed. Is it just me? Yes, it's just you. Basically, because your tube was removed, the tether that holds the ovary is not there. So they'll find it as it grows, typically, and they may have to push on your belly a lot to find it. This is Jen. I'm doing 6th IUI next month. Do you think I still need to pursue it? Nope. The 6th one, yeah, if you already have it planned, but after 6 IUIs, nope. What supplements should be taken and what amount to prep for IVF? Angela, just download our family building guide. You can get it at the CNY Fertility website on the resource page. Just download the guide and you'll be good to go. Jessica, why is PG tested not considered to be helpful after 40? It's basically because it's a very long story, but basically it's much better to put the embryo inside you. Yes, it means you may take a little longer getting pregnant, but there's always a risk to doing any kind of intervention on an egg. And since there are very few eggs in women over 40 or few embryos, you might want to leave them alone and let nature help you. That's kind of the consensus. It's called embryo wastage. Big, long discussion. We could do that on another talk. Would a tilted uterus cause issue with transfer? Not likely, facing destiny. Does a retroviewed uterus impact one's ability to get pregnant or carry a healthy baby to term? Not at all. I was not able to take progesterone after my IVF. It made me sick. 39 years at 3 weeks. Did the no progesterone? Well, I hope you did HCG booster shots. You said it was fresh or frozen. There's got to be a progesterone you can use. Best time to take progesterone after trigger for IUI, 2 days. How many months before retrieval do you recommend doing acupuncture? At least 3 if you can, but 2 or 1, you're in good shape. I went for my baselines today. I had an ectopic pregnancy. Thanks for the kisses. An ectopic pregnancy in November with a fresh transfer. Statistically, are my chances for getting pregnant again good? Yes, actually. Mrs. Therasax. I'm from the UK and I'm so excited to start the journey. What's the waiting list like? Well, I think it's about 3 months, 2 months. Amanda, if we plan to go ahead with PGT but end up having low egg count or retrieval, can we opt out? Yes. Kaya, I'm sorry, can I just do progesterone suppositories instead of the shot? I don't recommend that. First failed cycle as low responders to meds, only 1 follicle after 9 days of stim. Apart from a new protocol, anything else I can do on my own to prepare? Acupuncture, serovital, growth hormone, low carb eating, meditation, prayer. Do you recommend acupuncture on the day of frozen embryo transfer? Absolutely. And has it been shown to improve pregnancy rates? It's my research, my dear. There's lots of research on looking at the impact of acupuncture on IVF outcomes. All right, Sima Chiza. I'll see you in 17 days. If you have low AMH, can you still get OHSS? Not likely. I have PCOS, no period for 9 months, 4 failed IUI. What do you recommend to better my chances for this is Queen Marcy, acupuncture, low carb eating, take your vitamins, avoid alcohol, tobacco, drugs, get on serovital, get on growth hormone. What do you recommend to do for a low dose protocol, Dr. Magarelli? When do you recommend to do? I thought Vix, I said when there's low ovarian reserve and usually over, and then sometimes over 42 or 43. Chilla, before and after with acupuncture. Yes, love it. Okay, good. All right. Good. Okay, I have PCOS and I'm taking myoinositol. Do you think it is the best supplement that I should be taking before IVF? It is one of the important ones, yes. When do you say to avoid carbohydrates? Do you mean refined? Are whole grains okay? No, any carbohydrates, fruits, juices, vegetables, breads, ice cream, candy, cookies. So look up Dr. Kiltz's diet. He has booklets on it, and you can download it. It's all there. Okay, what should we expect from our consult? Also, how soon after they prescribe the medication is needed? Sorry, I'm super excited, so close to our rainbow. Well, what we should expect from our consult is a good discussion of your history. So make sure you know your history, dates, times, things you've done. Even if you've uploaded, we're still going to ask you questions about it. You know, if you're HSG, your sperm analysis, you smoke, drink, drugs, you take vitamins, you're doing acupuncture, all of these things are really important. Chile, how successful is IVF the first round? It depends on the age of the person. Thanks for the kisses. Serovital, yeah, S-E-R-O-V-I-T-A-L, not vitals, but serovital. Serovital. Okay. When do you stop Lovenox injections? When pregnant, you need to talk to your OBGYN. They will probably guide you, and probably sooner than later. Should our partner also have low carb diet as well? Yes, because remember, sperm and eggs. So Kaylee, you're 29. The chances are about 30 to 40% of getting pregnant with regular IVF, and about 60% with IVF with genetic testing, if everything is normal. And I don't know if everything is normal. Thanks for the kisses, everybody. Definitely try to have all your lab results, previous protocols, etc. Know your numbers. Yes, know your numbers and write them down. It's okay. Write them down. Best solution to a blocked tube is IVF. That's your best solution to making a baby is IVF. All right, folks, I'm winding down. My voice is going. Now, my consultation, I was told a low-dose protocol will be used for me. Does this sound right? 34, 5-field, I have blocked tubes. Well, Angela, I'll tell you what I think. I think you're doing a low dose protocol because of your PCOS, which is good because it's safer. Serial Vital is useful for everyone. There's no downside to taking it. People have opinions. Low dose naltrexone, should we take it? I don't have an answer for you, clear answer yet. I'm still looking at it. Can I do IVF with fibroids? Well, it depends on where they are. If they're inside the uterus, you don't want to do it. If they're outside the uterus, it should be okay. Is it better to do PGT for 40 plus? Nope. I'll be using my husband's frozen sperm that is stored in UK. Have you had any problem with them being transferred to your clinic? No idea. Don't know your clinic. If my CYN consultation was a year ago, should I do new tests? Yes. Update what you have. If they used half a vial of donor sperm, is it still okay to use at the next retrieval? Sure. Okay. I am going to call it an evening. Thank you so much, all of you. I don't know how many questions I answered, but it was absolutely wonderful. Please download the progesterone talk. It's going to be saved. Please tell folks. Tell us what we're doing right. Tell us what we're doing wrong so we can get better. Thank you so much for joining me. Yes, marijuana does affect fertility. Good night, sir. Thanks for your insight. Looking forward to seeing you. Thanks, everybody. I hope for a pregnant future for everybody. And thanks for joining me. And I'll see you next week. Questions and answers next week. Take care, guys. Bye.